Okay, hi, Dave with Align Therapy here. I'm sitting here with Chloe and her mother. Chloe is an awesome patient that we've known for a while, and she has a cool story with VBT, so Vertebral Body Tethering. So we wanted to talk about that a little bit and get her perspective on that, and also talk about recovery and preparation for VBT surgery. So thanks for being here with us, but let's talk about kind of how VBT went. I don't know if you want to say or your mom wants to say.
It was good.
It was good. It was all great.
Yeah,
It was awesome.
no, it was life-changing.
Life-changing.
Yeah.
So before surgery, you had a 56-degree scoliosis curve,
Yeah.
which puts you in the range of needing scoliosis fusion, but you were how old at the time?
Like,
Were you 11 at the time?
yeah, I
Yeah,
think
last.
so.
Yeah.
It was last October.
Yeah.
So 11 years old, they don't usually like to fuse the spine at 11 years old because you have a lot of growth left, right?
Yeah.
And so 56 degrees, you technically could have had a scoliosis fusion, but good thing there's VBT that we could use growth to help reduce the curve, right? So you went in to have VBT. How was recovery from that?
It was good. Just like a little sore.
Just like a little sore?
Yeah.
So you didn't have a whole lot of pain?
No, not that much because
No.
I was like still like numb.
You're still numb.
Yeah.
So you
I
felt
was
good
numb
afterwards?
for like the next like few weeks still after the hospital.
So did the pain come on after a few weeks, or you didn't really ever have much pain?
It was like kind of sore when I started walking more, but like it wasn't bad.
It wasn't too bad.
Mm-mm.
Do you remember anything with that, like pain-wise?
I remember she didn't like to lay flat, like on her bed. So
now
we
I
had
do.
that camping chair that leans back, and she slept in that for probably a month.
So
And I slept in your bed too.
Yeah.
Sometimes.
So kind of a quick tip, maybe a camping chair,
Yeah.
Was it a zero gravity chair?
Yeah.
That helped to offload things while you were recovering. So
Yeah.
fantastic. And then, so you recovered from that. How long before you got back into, one thing about Chloe is she does competitive cheer. She's fantastic at it. How long before you were able to get back into cheer? Do you remember how long that was?
Like around 4 months when I was
4 months?
cleared to do most stuff.
Was it hard to get back into cheer? Like, was it hard to get back into everything that you had done in the past?
Not really.
She kind of bounced back so fast.
Yeah.
Everyone was surprised, because she hadn't done back bends or handstands or cartwheels or anything for probably almost a year. And
wow.
So, for her to go back, she kind of had to start learning her back walkover first again. And and by the end of that appointment with her coach, she was doing back handsprings and back to where she was before.
Like that day?
Yeah, the same day.
What?
I know.
In like an hour.
Holy
But
cow.
then she was definitely sore and she had to work into
You're like
back in shape.
Oh yeah, I haven't done this for a while. Okay.
Yeah.
So before you had surgery, you were having back pain, you were having difficulty with cheer, stuff like that. So that's pretty cool that 4 months after surgery, you're able to get right back into it. Sure, the muscles had to catch up and stuff like that, but that's really cool. Did your doctor give you any restrictions on what not to do?
Right after the surgery, she wasn't allowed to jump
anything,
or
run
or nothing,
or like twist
with hard impact. He kind of wanted her just to kind of stay grounded, and she's so always bouncing off the walls and all over the place, and so so she would be doing things, and I'd be like, no, you can't. But she also had like is it a spirometer? And she had to use that, and how many times a day? She had to hit a certain goal.
Every hour.
Yeah.
Yeah. Just because they deflated her lung, and so they wanted to keep that.
Well, and we were talking before, and Chloe's like, I didn't even know they deflated my lung until later. She had a big scar where the chest tube was in and stuff like that. not a big scar, a small scar. So on that topic, do you mind if we see what the scars look like after a VBT surgery?
I don't mind.
Okay, so let's see. Go ahead and stand up. And so with VBT, they go from the side. So there's a incision right there. I don't know exactly what he puts in there, but
my chest tube one right here.
Chest tube scar there, and there's one on the back. So yeah, were there only those 3?
There's more.
Oh yeah, there's one right there.
Yeah.
Okay. Okay, cool. So yeah, pretty minimal scar. Not anything huge, not anything crazy. Are they sensitive?
No, not really. But like after the surgery, they kind of were.
And
Because they were like still like numb.
Yeah, so they were
After like a month.
numb, and as they started to wake up, maybe it got a little itchy. Okay. Well, those look really cool. One other thing that I want to show. So before you went in for surgery, if I had you bend forward, wish we would have videoed this before.
I think
if you had bent forward, you could see the rotation in the spine. Mm-hmm. And one thing that's interesting, Chloe just saw a picture of her from before surgery when she was here in the clinic, and she's like, holy cow, I can't believe my curve was like that, because now she's pretty dang straight, down from 56 to 10 degrees, you said? So pretty awesome. So let me show that.
Okay.
Go ahead and stand up and face the other way. So just standing like that, I mean, heck, if you didn't know what you were looking for, you wouldn't even know that Chloe had scoliosis.
It's crazy.
Which is crazy. So now bend forward. And normally with scoliosis, we look for one side that's higher than the other. We can see the right side is a little higher than the left, and a little bit down low here. But other than that, I mean, heck, go ahead and stand back up. Before surgery, you also had a shift in your pelvis. Mm-hmm. And we're not seeing that shift in the pelvis anymore. So I would say VBT-wise, huge success. And this is probably the best result from VBT that I've seen. And pretty cool. So thanks for sharing that. Hopefully other people who are watching this and want to know more about VBT or are hesitant to do it because it might, it's a little newer surgery, can see that there are benefits. Now the concern that Chloe's talking about is she doesn't want it to overcorrect as she continues to grow. She doesn't want it to go the other direction. And that's maybe something that we can cover in a future video, but there are things that they can do if that starts to overcorrect. But that was really helpful. Thanks for sharing that.
And she's grown 5 inches.
Grown 5 inches. And you probably have a little bit more growth left.
Yeah.
So we'll keep growing, keep correcting, and yeah, fantastic result. Pretty cool. I haven't seen you guys for a little while, so when she came in, and I mean, just looking at your back, that's pretty amazing progress.
It's really amazing.
A big takeaway is stay active. The more active and strong you are, the better you recover from this, especially lung-wise. Mm-hmm. And yeah, I mean, look into it. And she's very flexible too, and I think that also helps with the correction. So, all right. So stay tuned. We might talk about VBT again.